Happy Wednesday, everybody. I am Kristen Maka with Futurity First Insurance Group, and welcome to Kristen's Nuggets of Knowledge. Now, as promised a couple weeks ago, we will be finishing up our discussions on the basic knowledge of Original Medicare. We will be putting all of that basic knowledge into this little box, and we will be tying it up with a bow at the end of today's session. I know that we've covered a lot when it comes to Original Medicare. So let's take a look at that movie reel of what we've accomplished on the discussions about Original Medicare. We've talked over the card. We've gone over the history. We've talked about who's covered, how to enroll. We've talked about Part A, the costs and coverage of it. Also, I snuck in a little video here on the different myths of Original Medicare. We've gone over Part B coverage, and today we are going to be talking about the costs of Part B. Of course, there are always going to be videos in the future and learning about Medicare, but this is the basic information on Original Medicare that we will be, as I said, wrapping up, putting it in our little box and tying it up with a bow at the end of today's session. So are you ready to go grab those little nuggets of knowledge? I know I certainly am. Let's go, shall we? Today is going to be a fun learning day. I hope that you've been watching all of the videos that I've been putting out. In particular, today we will be talking about, as I said, the cost of Original Medicare Part B. But because we're talking about the costs, we really need to have that health insurance lingo ingrained into our brains. And the one way to help us ingrain things into our brain is to quiz ourselves on them. So are you ready for Medicare Jeopardy? We are going to be doing the costs of Medicare Part B. All right, ladies and gentlemen, welcome to Medicare Part B costs. And today we'll be talking about health insurance lingo. All right, we've got our health insurance lingo here up on the board. Let's start with health insurance lingo for 200. This is the periodic payment to an insurance company to have an insurance policy in force. I know these are the easy ones. Hopefully we all got it. That is, what is a premium? And what does this bring up? Ding, 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 ding. Our first daily double. Now, when we're talking about the premium of Medicare Part B, it actually all depends on what we make, which brings up this daily double. So, an amount of premium for Medicare Part B if your adjusted gross income is above a certain amount. All right, this is called the income-related monthly adjustment amount. Oy, that is a mouthful. I just like to call it IRMA. And so what this is Medicare looks at the last 2 years of your annual adjusted gross income. So obviously they're looking at your Social Security tax return and finding out how much money that you make. For those that are filing as a single and making at least $87,000 or less, you pay the basic Medicare premium. If you're filing jointly, that number is $174,000. Okay, or below. And if you're anywhere above that, there's different tiers actually. And I will link in the bottom of the description a link to the Medicare.gov website where it actually has that full chart blown out. So you can see if you happen to be making more than either one of those numbers, then you can go in there and look to see what your Part B premium will be for the year. Okay. Other than that, the premium that we pay for Medicare Part B for the year 2020 is $144.60, and that is monthly, okay? Moving along, We've got health insurance lingo for 400. The amount you must pay for your health care before the plan begins to pay. All right, this is the amount of money that you have to pay before the plan actually will pay anything. Does anyone know what that is? That's going to be what is deductible. All right, you have to pay your monthly premiums, and on top of that, before the plan actually kicks in and the benefits start working, you have to pay what is called a deductible. So for 2020, Part B deductible is $198, and this is an annual amount. So as soon as you hit this $198, paying out of your pocket, the Medicare health insurance benefits will start to kick in. Once the next year starts over again, you're going to have to suffice that deductible once again before then the benefits kick in. It is an annual deductible. We've got health insurance lingo for 600. Is everyone ready? Everyone's brain expanded? These are going to get into the little harder questions. All right. This is typically a set amount that you may be required to pay as your share of the cost for a medical service or supply. So typically a set amount of money. That is our key word there, a set amount of money. We've got what is a copayment, or what some people shorten as a copay. So this is very typical of somebody that may have had a plan through work. You've got a copay when you go to the doctor or when you go to a specialist or the hospital. Each one of those copays is a little bit different, but it's a set amount of money. So just as an example, say the primary care doctor, $10, a specialist, $20, hospital, $50. Now, as we talked about in what Medicare Part B covers, there's a whole list of what Part B Medicare covers. And for each individual item, you're going to have some type of a payment scheme. So it's all going to depend on what your actual service is, if you have a copayment or not. And we'll go over that after our next item here. Health insurance lingo for 800. Are you ready? It's another toughie. Your share of the cost for service, usually a percentage, that's the clue, after you've paid your deductible. And that is going to be co-insurance. What is co-insurance? Okay, so typically in Medicare, you're paying 20% of the cost of the Medicare approved amount for whatever service or maybe the durable medical equipment that you're going to need. Okay, all right. So remember in that last question, I said that we would go over an example. So I have gone over in the past this app that Medicare has. It's called What's Covered. So if you look on your phone, I hope you can see this. There we go. All right, so we've got the What's Covered Medicare.gov app open, and last time we did look up items that were pertaining to diabetes. So let's do that again. Right, there we go. So as we're punching in diabetes, a list starts populating of what they think that we're probably going to be looking for. So as we've talked about before, all those items there that have the apples, those are preventative service. So those are taken care of by Original Medicare Part B. So if we look down here, let's go to this eye exam. So we click on the eye exam, and eye exam for diabetes, it has to specify for diabetes. It is covered under Medicare Part B. All right, you've got all those different things down there, and then we can look here at the cost. So we've got here on the cost, it says you pay 20% of the Medicare approved amount for your doctor service. So you're paying a what? A 20% coinsurance. All right. And the Part B deductible applies, of course. That's that $198 annually. And then it says here, in a hospital outpatient setting, you pay a copayment. So that may be all depending on your situation. It could be a little bit different, all depending what hospital that you're at. But maybe it's a $50 copayment that you have to make for this particular service if you are in a hospital outpatient setting. Okay, so I'm not going to go over every single scenario that's out there, but you have a way to figure it out on your own. And what's better than that, to have the empowerment of the knowledge. All right, back to our game. Lastly, we have here health insurance lingo for $1,000. You can be subject to this if you decide to defer Medicare Part B without having credible coverage. Now, we've discussed this a little bit in a couple different videos, and you can have one of these for Part A as well as Part D, and we will get to that much later on. But this is what is a late enrollment penalty. So if you've decided that you don't want Part B, that you're going to defer it because you have credible coverage through a spouse's health insurance or your own health insurance through a job, that is completely all right. But if you've decided to defer having Medicare Part B because, let's say, for instance, you think that Kroger insurance is credible coverage, which it's not, by the way, take note of this, and you've decided to defer Part B for 27 months, okay? When you then decide to sign up for Medicare Part B, you will be penalized. And that penalty this year in 2020 is 10% for every full 12 months, every full 12 months. So in our example, I used 27 months, but it is on a 12-month basis. So you will only be fined 20%, and that 20% is going to be tacked on to your premium indefinitely. So every single month you are going to be paying that penalty for not having credible coverage or having Medicare Part B in place when you should have. Okay, so I know that we've covered quite a bit when it's come to the different terms, the different lingo, but we've covered everything as far as the costs go on original Medicare Part B. So let's just kind of briefly go over them real quick here again. So we've got the different costs. We've got our premium, which is our monthly cost. And for most people, that's going to be $144.60 monthly. Then we come to our deductible, and that's annually. So this deductible is something that we're going to have to pay and suffice prior to the health insurance kicking in for us. Once again, that deductible resets every single year, and sometimes it can go up. Just saying. Be aware that any one of these numbers, because it's Medicare and the government can change it whenever they please, to be aware that the premium, the deductible, your coinsurance, any copays, the penalty can be changed at any time. But in the year 2020, these are the numbers. Next up, we've got our Part B, what it pays. So after you've hit your deductible, the plan will pay 80% of the cost of your Medicare approved amount of care. After that, your coinsurance is 20%. And then, of course, any copays as required per the service, as we went over with that diabetes eye exam example. And then lastly, if you've deferred Part B without having credible coverage in place, there is a penalty, 10% for every full 12 months. Whew. All right, did you get all that? Hopefully all of that stuck in and you were able to remember all that health insurance lingo. Wasn't that great to have that little bit of review? Oh, let's get that box tied up with a bow. As promised, one box of original Medicare basic information wrapped up with a nice little neat pink bow just for you. If you have any questions, please feel free to give me a shout and I will answer them as best as I can. If you've enjoyed the way that I've presented this information, please give me a thumbs up for my efforts and press that subscribe button. Thanks so much again for tuning in. We will see you next week. Bye!